Now we are going to discuss inflammatory conditions of stomach. Two important gastric inflammatory disorders. Number one, gastritis. Number two, peptic ulcer. Rarely, stomach is also involved in tuberculosis, sarcoidosis, and Crohn's disease. But we should know that they are important. Okay, gastritis, it is simply defined as inflammation of the gastric mucosa. If somebody asks you what is gastritis, it is defined as inflammation of the gastric mucosa. It is of two types: acute gastritis, which can be infective or non-infective. Infective includes bacteria, viruses, fungi, parasites. Whereas chronic gastritis, when we talk of chronic gastritis, we'll discuss it in detail. Type A, autoimmune. Type B, due to H. pylori. And then there are certain environmental factors and chemical reflux, and there are other uncommon forms. But mainly we are focusing our discussion on these two. Okay. So gastritis in detail, the definition is an inflammation of the gastric mucosa, stressing on gastric mucosa. It's an inflammatory process of gastric mucosa, but in severe cases may involve submucosa and even muscle. Generally, it is a diffuse process. That is, the entire stomach is involved, but more marked in the region of pyloric antrum and body close to the lesser curvature. So, inflammation of the gastric mucosa, severe cases involving submucosa and even muscle. It is a diffuse process involving the entire stomach, but more marked in the region of pyloric antrum and the body of the stomach, which is close to lesser curvature. Acute gastritis, it is an acute inflammatory process of gastric mucosa, usually of transient duration. Now I left this word active. In the present literature, active inflammatory process is used because neutrophils can be found in both acute and chronic gastritis. So they use the word active inflammatory process of gastric mucosa, usually of transient nature, because it is believed that the term acute, when you say acute, is used to refer to disease duration instead of its pattern. So when we say acute gastritis, it refers to disease duration rather than its inflammatory pattern. So word active inflammatory process is used. But if you can define it as it is an acute inflammatory process of gastric mucosa, usually of transient nature or transient duration, okay. But if somebody asks you what is active inflammatory process, then you say that in GIT, Acute term means that it is the disease duration rather than the inflammatory pattern. In severe cases, ulceration and bleeding can occur. Of course, when it is severe, ulceration and bleeding can occur. Etiology, personal and diet habits, smoking, alcohol, spicy food, malnutrition. Now, there is a tip if you can, all GIT diseases put smoking and alcohol as etiological factors. And in all the cancers, just write down smoking. Infections, most important is H. pylori, that is Helicobacter pylori, Salmonella, diphtheria, staphylococcal food poisoning, viral hepatitis, infectious mononucleosis, drugs like non-steroidal anti-inflammatory drugs, aspirin, corticosteroids, indomethacin, phenylbutazone, iron preparations, and chemotherapy. So you can remember certain drugs like these, corticosteroids and chemotherapy. Physical and chemical agents like caustic soda, acids, alkalis, phenol, lysol, radiations, they all can cause gastritis. Stress is an important factor for causing gastritis, and we will discuss in detail stress induced gastropathy. And in the stress, number one is shock, burns, and surgery. Psychological factors and acute inflammatory changes are seen in emotional conditions of various types. These cases are of very short duration, but emotional stress of longer duration can produce permanent changes. Pathogenesis. The gastric lumen has a pH of around 1, very high pH. And this pH, it is important in digestion, but on the other hand, it has potential to cause damage to the gastric mucosa. Foveolar cells, they produce secretions which are forming thin layer of mucus and phospholipids, preventing food particles to touch the epithelium of the mucosa of stomach. The secretions of bicarbonate ions bring the pH of the mucus to neutral. Now there is a formation of barrier by the mucosal epithelial cells. So mucosal epithelial cells, they are forming a barrier. This physical barrier prevents the backward diffusion of acid and digestive enzymes into the lamina propria. So if you see that these are the cells and this is the lumen, what happens is that the gastric contents in the lumen cannot go or diffuse out into the lamina propria. The rich vascular supply of mucosa help to deliver the oxygen and other nutrients. So the mucosa of the gastric is very rich in vascular supply, and this helps to deliver the oxygen and other nutrients, but at the same time it also removes already diffused gastric acid from the lamina propria. As I told you that the mucosal cells form a barrier and it does not allow the acid to move into the lamina propria, but somewhat a small amount of gastric acid which is diffused, that is being removed by the blood supply. When there is imbalance between the damaging forces and protective mechanism, gastritis and gastropathy results. So it is an imbalance between the damaging forces and the protective mechanism present in the stomach. What disrupts the protective mechanisms? Number one, inhibition of cyclooxygenase COX by non-steroidal anti-inflammatory drugs. Now, these non-steroidal anti-inflammatory drugs inhibit the synthesis of prostaglandin E2 and I2 because both these prostaglandins are cyclooxygenase dependent for their formation. Let be for their formation. For their formation. Okay, I repeat it once again. Inhibition of cyclooxygenase by non-steroidal anti-inflammatory drugs, and with the result there is inhibit synthesis of prostaglandins E2 and I2 because both these prostaglandins are cyclooxygenase dependent for their formation or for their production. These prostaglandins are responsible in protective mechanism like mucus, bicarbonate and phospholipid secretion, mucosal blood flow and epithelial restoration. So the function of the prostaglandins are they are forming a protective mechanism like mucus, bicarbonate, phospholipid secretions, maintain the mucosal blood flow and epithelial restoration. Reduced bicarbonate ions. Gastric injury takes place when there is inhibition of gastric bicarbonate transport by ammonia ions, which is seen in uremic patients and with H. pylori infection. I repeat this that reduced bicarbonate ions gastric injury may take place when there is inhibition of gastric bicarbonate transport by ammonia ions, which is seen in uremic patients and patients with H. pylori infection. reduced excretion of mucus and bicarbonates that is seen in older patients or people in old age people. With the result, these old age people are more susceptible to gastritis. Now, there is another important factor: decreased delivery of oxygen. This results in high incidence of acute gastritis in people living at high altitudes. Pathological changes, edema, hyperemia of the gastric mucosa, and lamina propria seen in milder cases. But there is patchy ulceration and erosion of the superficial mucosa in severe cases. They contain neutrophilic infiltrate. Now, this is important that these erosions, they contain neutrophilic infiltrate and fibrin containing exudate within the lumen. The hemorrhage presents as dark punctum or dark punctum when it is singular. Within the hyperemic mucosa, it presents as dark puncta or punctum when singular. You use the word. Within the hyperemic mucosa and termed as acute erosive hemorrhagic gastritis. These changes are quite superficial and seldom involve the entire thickness. Microscopic features: briefly, that there is neutrophilic infiltrate in the gastric mucosa, epithelium, and lamina propria. Erosive gastritis I've already discussed with you. Hemorrhages on the surface. Acute erosive gastritis. Now you can well appreciate larger areas of gastric hemorrhage that are best described as erosions. Erosions because only superficial mucosa is eroded away. Now, this is a photograph showing acute gastritis. Almost whole of the stomach is destroyed by the intake of acid or alkalis, which produces severe mucosal damage. Alkalis are worse and usually produce ulceration that may extend and through the muscular wall of the esophagus and the stomach. So whole of the stomach is destroyed. I should not cross it, rather I should write it. Destroyed. Acute gastritis continue. Histological features you can see in high power view: infiltration by the neutrophils. Infiltration by the neutrophils. Clinical features: well, if it is of very short duration, asymptomatic, may present with epigastric pain, nausea, vomiting, hematemesis when there are erosions, and those erosions, they are deep, melena, and fatal hemorrhage as a complication. Now I request you that if you have got any question, kindly write it in the comment box and inshallah I'll answer that.